started the process now that you and Tiff have completed the early stages of communication and trying to get this case off the ground. I love the way the teeth look, but in order to get here, we have a space issue or space restriction issue. So I just want to share with you some thoughts. And what I'm going to do is turn off the wax up, which is the proposed teeth. And let's bring this guy in. All right, so this is where you are now. This is a kind of case that appears easy on the surface, but is very tricky to solve. Not something I haven't done before, but I need to make sure that I incorporate you in the decision-making process so that we know what the outcome is going to be and what its strengths and limitations are and what potential pitfalls might exist. So this is not the kind of case, unfortunately, where you come in, we prep the teeth, you come in 3 weeks later and you get the final veneers or crowns and you're good to go. There's several steps I want to take before that point to make sure that we're ending up where we need to be. So I'm going to share with you how your particular wear pattern sits in the grander scheme of wear patterns with other patients so that you can get a sense of why this one's more complicated. So posterior teeth, you didn't wear. You haven't worn too much at all. It's primarily anterior wear. Essentially what you do is you take your lower jaw for whatever reason, I think it's airway related as we discussed, and you grind your front teeth. It's a subconscious thing, so don't think it's anything that you can control with any sort of predictability. But what happens when your front teeth wear is they erupt. Teeth will always drift until they meet an opposing force, which means they're going to drift. The upper teeth are going to drift down, and the lower teeth are going to drift up. And that's exemplified pretty clearly by this undulation that we have here. We call this an undulation of the occlusal plane. Basically what has happened is these two teeth primarily wore and then drifted up until they met the upper arch. And really the rest of the anterior arch is the same. So this whole interior segment, to varying degrees, has drifted up as a result of the wear. What's interesting is you haven't really worn your posterior teeth. And this particular combination of anterior wear with what we call compensatory eruption provides a challenging foundation for us to build an ideal aesthetic outcome. So I know how important this is to you. I know how long you've been waiting to do this. So I want to make sure that I'm delivering a product that in your mind's eye matches to what your expectations are. And what I'm sharing with you here, based upon my analysis of this digital wax up and digital mock-up, is it's harder than I thought initially, based upon the measurements that I have with this software here. So in a nutshell, anterior teeth are worn, they've drifted up. There's not a whole lot of space for us to create this. So the way we do cases, at least most dentists I would imagine, is we idealize the upper arch and maximize the aesthetics of the teeth. So based on my conversations with you and the photos that we took and the impressions, I think these teeth would look good in your face, the upper teeth. In order to get there, we have to create enough space on the lower arch in order to maintain functionality. And the problem is these teeth have drifted so far up that I don't really have a whole lot of space to create the crowns. Now, these crowns in yellow would be ideal crowns in the current tooth position. Okay, so yes, I could shorten these to get away from some of the space restrictions, and all of the purple that you see is essentially where these potential crowns are interfering with the ideal crowns from the upper. That's the space restriction I'm talking about. So essentially, if we kept the uppers ideal, I would need to create a tooth, lower tooth, that's this right here, which is extremely small. not surprising that this level right here is the same level as your occlusal plane in the posterior, where you haven't lost any tooth structure and had any eruption. So if I draw a line here and then come across, you can see that everything above where I'm drawing the line is purple, because that's where the teeth have over-erupted into the space of an ideal aesthetic outcome. So when we had first met, I had proposed the idea of orthodontics, which I don't think you were particularly excited about. I think we revisit that more than ever based on my analysis here. Basically what I'm saying is restoring these teeth from a restorative perspective, meaning only using crowns and or veneers, I think is going to be challenging and come with some pitfalls. So one option I'd love to hear your thoughts on is to use orthodontics to get these teeth lower down so that the necks of the teeth are like down here, so that they match this level. And what that would do as they intrude is give us some space. All right, so here's where your teeth are now. As these intrude, it would create space above them for us to put crowns that look good on the lower, but also match to the ideal on the upper. So that's option one. Option two is we surgically remove some of the gum tissue here and the bone in order to access more tooth structure, so I can put normal looking crowns. When I say normal looking, meaning of normal height, and at the same time creating enough space for the restorative material so that it doesn't interfere with the upper. So essentially what we'd be doing is cutting everything above this line right here. We'd be cutting away, and below creating crowns. This option, crown lengthening, is done often. Definitely something I can do. It just destabilizes the bone and the foundation of the surrounding structure of the teeth, which over the long term may or may not compromise the structural integrity of the tooth as we're removing some of the foundation. These two teeth I'm mostly concerned about. These in the front, I definitely could do without much of a problem at all and not be overly concerned we're destabilizing the teeth in the long run, but it's these two here. So if we're gonna consider this option, I would want to have a discussion with you in person and explore this in a little more detail. The last option is to compromise the aesthetics on the upper and the lower. In other words, we try to find the most ideal aesthetic outcome. See if I can get all of this in the same view. There we go. So I modify these so that the uppers maybe don't look ideal, but they look as good as they can in the presence of the lower teeth being where they are. So essentially I would create crowns probably at this level right here, kind of coming across, but I would need to compromise the aesthetics and maybe the integrity of the upper teeth in that process. So that's where we are as far as potential solutions. Now, what I would propose we do, I come up and I transfer this to your mouth using composite. And what I would be doing is giving you several weeks to test drive the aesthetics of the upper, and then we basically go until we're very happy with the aesthetics of the upper. And at the same time, I would kind of smooth down this hump right here to accommodate those upper teeth, and I'd probably put some composite in these lowers just to fill them. Essentially, I'm not crowning these teeth. What I'm trying to do is get a sense of the ideal upper aesthetics in the presence of a modified lower arch. And then, several weeks from that point, we meet and we go over the findings. If you don't like the uppers, we modify the uppers. If you like the uppers, then I have to then answer for you, how do we get there on the lower arch? So how do we get to the upper aesthetics by modifying the lower arch? And then we say crown lengthening, orthodontics, so on and so forth. So pretty complicated case, complicated in the fact that there's a lot to consider here. I absolutely love the case. It's a great teaching case, one that I will definitely bring to the masses, in great part because these cases show up often, and there's a lot here that would be overlooked if the dentist didn't necessarily have the training and or the technology to see these things in the fine detail that we have here. So send me your thoughts, and let's continue the conversation. Happy to hop on a phone call or plan on just meeting next time I'm in the office, and we can go from there. All right, Rich, we'll talk to you soon.